we go. So, Dr. Emily Tucker is an assistant professor at Clemson. She's in the Department of Industrial Engineering, and she's also a faculty scholar in the School of Health Research. Her research focuses on improving access to social good for systems, for resource-constrained systems, for systems under strain. She received her PhD and master's from University of Michigan in IOE. She was supported by an NSF GRFP, the Graduate Research Fellowship, during her dissertation work, and it was also then awarded a University of Michigan Richard and Eleanor Towner Prize for Outstanding PhD Research. Prior to grad school, she worked as a research health economist at RTI International and received her bachelor's in industrial engineering from NC State. We are very happy to have you here, Emily, talking about the global drug supply and mitigating new threats.
Fantastic. Thank you so much for that intro. And it's such a pleasure to get to chat with you all today. So as Alexander said, I'll be talking about the global drug supply. So if you haven't heard about it with COVID, it's been under strain for a long time now. So we talk about some emerging threats. In particular, this work is done in collaboration with one of my PhD students, Martha Sabogal. Let me click to the next one. She is outstanding and the brains behind this operation. So I hope you get a chance to meet her at some point soon. So when it comes to the problem of a strained supply chain in general, maybe we can look back a little bit. What does a supply chain look like? Well, the idea is we have some suppliers of raw materials. They end up producing the finished form of the drug it manufactures, and it continues on with the end goal of getting to patients. So in these IV bags, that's the end goal. We want to get these intravenous drugs to patients. Unfortunately, this is not as clean and as smooth as we would like it to be. Especially in the US, we have had shortages of life-giving medications since the early 2000s. And so pre-COVID, even hundreds of drugs are short annually in the US. This also occurs around the world. There's been major studies within Europe and other regions trying to figure out how do we crack this issue. Oftentimes, if you know what the cause is, it's because some sort of supply chain strain or disruption. It could be contamination or a quality issue. It could be a natural disaster or other types of just supply and demand mismatches. So within the US, that's the vast majority of shortages, down to about half of shortages in Colombia. Unfortunately, when it comes to addressing these problems, the research to date has been very regional, and so including my own, so that's a critique of my own. So if we're trying to figure out how do we address shortages, it's often focused on, well, how do we get drugs to patients in the United States or to patients in Europe or in other regions around the world? And so really we're missing this global interdependence when it comes to shortages. Pharmaceutical supply chains are internationally based. If you locate in the US, you're not only going to serve US patients, you're also going to serve other patients in other countries around the world, and vice versa. And so that leads to large integrated decisions that to date we haven't really been thinking about. The second aspect is it's not just high income and upper middle income countries that need medications. Certainly low and lower middle income countries do too, but there's been large research deficits in both of those areas. Now, I do want to acknowledge there's been a little bit of research on global pharmaceutical supply chain design. I'm not going to go too deep into these, but they tend to focus on a subset of regions rather than looking sort of at these global integrated issues. A lot of the work is also coming out of operations management, which really sets the groundwork for interesting studies of decisions in this context. And so that leads us into the main purpose of this talk. If we want to consider sort of global supply chain redesign, well, we need to consider the relevant risk. And one that's emerged in the past handful of years is geopolitical strain. And so in particular, that involves export bans. So given we have these persistent shortages, One mechanism countries have or are threatening or have decided to enforce is if drugs are produced in the country and there is a shortage globally, they'll choose to not allow exports. Now, this becomes a major supply chain design question because if there's a risk that you might not be able to export out of a country, that could lead to major changes in how you select and design your supply chain. So to zoom back just a little bit, let's say you locate a plant in Italy. There's different types of strains that this could incur. It could be affected by disruptions at the suppliers. So if you don't have your raw materials coming in, you're not going to be able to produce the finished form of the drug. There are sort of these standard manufacturing disruptions, which has been to date included in many types of models. And then we have this last aspect, the flow out. And this is really the new aspect of this paper, is what happens when we have the risk of export bans. Again, the purpose here is rediverting that supply to that country. The idea is Italy in this scenario would be able to meet demand for their drug, but that has ramifications for the global access as well. So what questions are we going to answer today? Well, one, we're going to think about how these risks affect where you locate the plants to begin with in this new era of geopolitical strain. And the second is looking at how these bans might affect global shortages. These are large, tricky, discrete questions. Where do you locate things? And so especially because this is a dot, we're going to say discrete optimization to the rescue. So this will be a discrete stochastic analysis. So what is our approach? We're going to take the perspective of a pharmaceutical company. So a single company trying to produce a drug that's looking to redesign their global supply chain. I'll note from conversations with manufacturers as well as trade groups, this is a very pressing real world question. Folks are trying to think about, well, what should my global footprint look like? The supply chain, we're going to look upstream, thinking about we know where suppliers are located. In particular, we're trying to figure out where we should locate our plants, and then demand nodes are countries around the world. Each country also may have other exports of the same drug. So we're in this generic pharmaceutical space. So even though we're thinking about one particular company, there are other competitors in the market that are also, that may also be producing in that country or in other countries around the world. So export bans would not only affect your company, this decision maker, but also others in the market. These risks involve disruptions at both the manufacturer and the supplier, the risk of export bans. And then the costs will have some of those standard costs. We'll have fixed facility and variable shipping. So transportation is a big thing. Raw material and other types of production. These vary depending on what country you locate in, and then shortages. Now, the shortages change a little bit from standard types of models. We do have this opportunity cost based on the cost of, or the price of the drug in the country. But we'll also have the second parameter that will indicate a price increase due to export ban-induced shortages. So if there is an export ban and that causes shortages, well, that supply shock is going to affect the price as well. We're going to take an expected value approach to a two-stage stochastic program. Unfortunately, in this context, generally, pharma companies are not risk averse. They're trying to maximize expected profit. And so we'll follow that in the structure and the framework of this model. So stepping back, let's take a little bit of an abstract view of our decisions and uncertainty to introduce the notation. We have four main sets: suppliers, candidate plants, we have countries, which are demand nodes, and then a finite set of scenarios. We'll have our timeline, and before we even get into the model, we have these exogenous factors. We have these exports, which are known and considered exogenous from other companies. We also have a set of strategic allies. So this is based on if the drug company is based in the United States, well, they would be affected by US trade agreements. So that may affect export bans. Okay, so we have this external scenario. In the first stage of the model, here's where we have this beautiful discreteness. We're going to locate our plants. We're going to decide, are we going to select a given option or no? After we make that decision, uncertainty is realized. We observe demand around the world. We have plant capacity, which may be affected by different types of disruptions, supplier as well. And then we have this joint conditional probability if a country is going to allow exports. And I'll elaborate on that a little bit more in the next slide. In the second stage of this, we'll have these operational decisions. The company will buy and ship raw materials, they'll ship the drugs to the countries, and there may or may not be shortages. So again, we have sort of a strategy, we have operations, and we have uncertainty underlying sort of in between the stages. Providing a little bit more detail on the export bans, and I'm happy to talk about this offline, but this idea of whether a country allows exports, so country J, that's going to be binary. It either allows exports or not. Well, we have two steps. It's conditional on the raw material capacity, and we're using this as a leading indicator of supply chain strain. So if the average capacity to produce the raw materials of this drug falls below a threshold, then we're going to sample whether the country will be open or not to exports. And that'll be controlled by this argument rho, and that will vary based on the risk propensity of the country. The second aspect I'll note is we have the shortage or opportunity costs. Again, this is another place where export bans come into play. Not only do we have the price of drug in a given country, and that varies substantially based on the country, we also have price increases based on export bans. And so this is a little bit more complicated than I'm presenting in the slide, but a bit of an overview. This is based on exports that are coming from that country that can no longer be exported. So exogenous exports that are being stopped. This is removing from the global drug supply, and so the price is going to go up. Okay. So if we put this together, we can present this two-stage stochastic integer program. In the first stage, we're trying to minimize the expected total costs. We have these standard fixed cost and expected variable. We're requiring them to select at least one plant because they have chosen to be in the market, and then we have this binary selection. In the second stage, we have this expected variable cost, and that's comprised of your raw material cost of producing the raw materials as well as shipping. We have cost of finished goods, again, production, which varies substantially based on labor cost in a given country, as well as transportation costs. And then this third sort of group of terms, these are our shortage costs, where we have the price in a country, as well as price increases due to export bans. Constraints, each of these are indexed over a given scenario. So we'll have raw material production and shipping. So that's conditional on raw materials, those capacity shocks, as well as aggregate capacity, or nominal capacity. We have production of the finished goods. And so this is based on sort of standard process disruptions. And then the second term is whether the country allows exports. We have capacity, and then we also have facility selection. Raw materials have to be available in order to produce the drug at a plant. We'll continue on. We have demand met and shortages. And then we have this auxiliary group of constraints, which the notation gets a little gnarly, so I'll just refer you to the paper, but happy to chat more. But this essentially establishes, well, what types of shortages should we incur this price increase? And then finally, we have domain. So if we put all of this together, we have sort of a recommender of where you should place your supply chain, given this risk of export ban and other external factors. How do we solve this? Well, we bring together a sample average approximation method with L-shaped. This is implemented in Python using Gurobi as the solver. It does relatively well in terms of computational performance. We solve it to a 2% optimality gap, and it takes a little less than an hour, at least in the base methods on our computing cluster with multiprocessing. This is a little bit sensitive to the parameter values we select, and so this is an open direction of research that we're exploring. But at least in the base version, with these base analyses, we can get fairly good performance relatively quickly. So let's hop into the analyses themselves. We're going to look at a pediatric cancer drug, vincristine sulfate. Unfortunately, this is one that has been subject to shortages for years in the US and also around the world. In terms of our sets, we'll have 11 suppliers distributed throughout the world. We have 60 candidate locations where you could locate a manufacturing plant, and then we'll seek to meet worldwide demand and consider 179 countries. If you're curious, the SAA, we use 30 replications of 100 scenarios, and then we evaluated with 2,000 scenarios. So not a crazy number. Okay, one caveat before we talk about country results and things. The goal of this is to introduce some new tools to address some of these questions, and also to get a sense of general trends. These aren't intended to reflect exact decisions that a given company or a given country would make, but sort of it's the main takeaway of what might happen in these types of scenarios. Okay, so if we run the model with values at baseline, so this represents current status quo to the best that we can do, our optimal solution is to select 3 manufacturing plants. We have one in Chile, one in Malaysia, and one in Indonesia. These blue represent expected flow of the finished good. Okay, so this is sort of physical supply chain, what's going on. In the next slide, we'll look at the effect on shortages. And so the white color represents 100% available in expectation. Black represents 100% unavailable. So that would be 100% shortage in expectation. We observe a couple things. One, that there does seem to be some geographical distribution in who is able to access the drug and not. If we look at the US, that's a light gray. That's about a 7% expected shortage, which for a medical product is very high. And that does reflect sort of standard availability in the US. More striking, though, are these dark black countries representing very little drug access. If we split this up by income level of the country, we observe that most of the high income and upper middle income countries have high, essentially low expected shortages at about 3 to 4%. If we look at the lower middle income and low income countries, though, their expected shortages are over 95%. So we see this big difference in who is able to have access to drugs if we're using a purely profit maximizing approach. I will note in practice, there are other sort of nonprofit supplemental types of programs that are able to divert drugs to these countries. However, if we're only looking at sort of the company planning approach, demand is not being met. So let's step back. Is it just because the export bans, they don't get the drugs? Well, unfortunately not. If we pull a handful of scenarios where there is capacity, everything's open, there are not disruptions, we still observe that high and upper middle income countries, their demand is met. We don't have shortages, which is what we would expect if everything's available. What's unfortunate, though, is the lower middle and low income countries, even when there's capacity available, the company is still choosing to not meet demand. Well, why does that happen? Well, it comes down to the cost of meeting that demand versus the price that the country would be able to pay to purchase the drug. Essentially, the costs are higher than the price. So we'll come back to policies that can address that. But in the next analysis, let's look at export risk. Okay, so we'll transition from baseline to what happens if the risk of export bans changes. The first thing we'll look at is what happens if there aren't export bans. And so this is the none scenario. This is when countries are always open. There may still be disruptions at the given plants, but the country itself is not closing the borders. This is reflected in most or just about all global redesign models today. The second, low export bans, this reflects the base case, what we're currently observing in practice and the results we saw in the previous slides. We'll then consider 2 other types of export ban risk. I would envision these being increasingly likely to happen sort of in our changing geopolitical scenario. So the moderate case is when countries are more sensitive to supply shocks. And so if So in the moderate case, we're raising this threshold for raw material capacity. And so if that drops to 90%, which is higher than the baseline threshold, if that drops to 90%, then the country decides to sample, or there's a risk of there being an export ban. In the high risk case, we actually maintain the same threshold at its baseline, but there's a higher risk, or there's a higher risk they'll close the borders, or essentially a lower risk that they'll stay open. So we'll look at these 4 scenarios. Okay, scenario 1, let's revisit the base case. So this is the same structure we saw in the preceding slides. Each of these dots represents a country's expected shortage. So one of these dots is the US, one of these dots is Colombia, one of these is Russia. On the x-axis, we have the income level groups of each country: high income, upper middle, low income. The y-axis represents expected shortage of that country in that scenario. So 0%, very good, 100%, very bad. Okay. At base case, we observe that low and upper middle income countries have pretty good shortages. When we have lower middle, low income, well, their shortages are quite bad. Okay, so now let's look at a different export ban scenario. What if we didn't have any export bans? So this would be the none in gray. In this case, we observe very similar results for high and upper middle income countries. For low, middle, and low income countries, though, we observe that demand is never met. This might be a little bit surprising because when there are low levels of export bans, it is sometimes met. And let's explore why. Well, so there's not a large impact. There's some demand met. It's because of these export ban induced price increases. And so again, the reason low, middle, and low income countries demand is not met, it's because of this trade-off of cost and price. Well, when there are export ban induced price increases, that price and cost trade-off shifts. And so sometimes it's good for that to be met. Okay. So this is comparison of none to base case. Now let's look at an increasingly risky world. What would happen then? If we have moderate risk, so the threshold for inducing an export ban increases, well, in this case, we see that there are reduced shortages for high and upper middle income countries. Why is this? Well, your optimal solution changes in this case. You're locating 1 more plant. Rather than 3, you're locating 4. And so we have this extra capacity maintained in the supply chain. We also observe some benefits for lower middle and low income countries. We observe their expected shortages vary from 50 to 60%. So it's still not good, but it's much, much better than at baseline. What if risk increases even more? And so we have a high risk of export bans. Well, high income, upper middle income, their shortages are quite low, but low, middle, and low income countries again return to high export ban, low availability or high shortages. Okay, so we've seen a lot of dots in these charts. What are we learning? Well, we're learning that high income and upper middle income countries tend to do pretty well regardless of the export ban scenario. So if we're living in a high income country, perhaps we don't have too much to worry about when it comes to export bans. However, these do have major implications for low and low middle income countries. However, there's still poor access. And so there needs to be other things, other mechanisms to promote access to these countries. One thing we could do is increase the price. And so just briefly, I'll note that if you were to increase the price of a low, middle, or low income country by 50%, well, we would observe much reduced shortages in each of these countries. And this is some of the policy implications and mechanism that folks have considered. What happens if we supplement or offer rebates or things such that it's companies are better able to promote access in these countries? All right, so I'm going to hop past these slides, but happy to chat more, and we can wrap up with the discussion. On the OR side, so integer discrete optimization has unlocked new potentials to address emerging geopolitical risk. These are a very big deal for modern supply chains that we need to think about, both in pharmaceuticals and also broadly when it comes to global manufacturing. We really need to be thinking about sort of geopolitical risk, whether that's either export bans or war or other types of conflicts. These could be incorporated via disruption risks themselves, price increases, and we could think about strategic alliances. For public health, specifically with pharmaceuticals, at baseline, we do need to think about companies might not be incentivized to promote access to low and low middle income countries, but price supplements could improve some of this. So with that, I'd be happy to take any questions you have or chat in our social hour. Thank you all so much.
Thank you, Emily. So I'll open up the floor for any questions, just like one or two maybe before we go off to the breakout rooms. I would like just a clarification on the surprising thing that you said, that when there is a low risk, that the low income countries actually have a smaller amount of shortages without building any facilities.
Mm-hmm.
Could you explain that just one more time for me, please?
Oh, yes, I'd be happy to. And I think part of it is they do build more facilities. And so looking at this, there are 4 facilities versus 3.
So I actually mean the gray to the blue line, the gray to the blue.
Oh, the gray to the blue. Yes, I would be happy to. Thank you. Yes, in that case, you're exactly right. You're not making more facilities. With the gray line, there are not export bans. You only have one type of shortage cost, and that's the baseline price. And in that case, the price cost trade-off is always the same. So you're never going to meet demand. With the blue, when there are some risk of export bans, there's another cost component. In addition to baseline, you also have price cost increases. And in that case, sometimes the trade-off crosses that cost price line, and it's better for them to meet demand there. So maybe said in another way, when export bans cause global shortages, the price goes up for both low and high income countries. And sometimes that's enough to serve demand in low income countries.
I see. Okay. Now that makes sense to me. Thank you.
Yeah, that's a good question.
All right. If there are no other, there might be other questions for the breakout rooms. So, but first, let's thank Emily and Marcia one more time. And as usual, from here, what we're going to do is we're going to break out into 2 rooms and have a social half hour or so. And for everyone watching on Zoom, I hope you can join us for our next dots happening in a month. Stay tuned for more details on our website and our mailing list.